Hi, my name is Caitlin Oslowski, and I'm going to do an irrigation of a nasogastric tube as well as a discontinuation or removal. So as I'm entering my patient's room, I notice that his stomach is very distended and that there's nothing in the tubing. So obviously there's a clot somewhere. So what I want to do is I'm going to take 5 to 10 cc's of air and I want to listen to the stomach and to try to hear that swishing sound. So I push that in and I don't hear anything. So now I'm going to try aspirate. So as I'm aspirating, nothing's coming out. So what I'm going to do is I'm going to disconnect and get my syringe, and I'm going to get 30 cc's of normal tap water. I'm going to connect it to the tubing here, and I'm going to use a pumping action to try to force that clot out. So once I'm doing that and I feel that clot move, then I can disconnect and hook back up to the suction. And every time you disconnect from the suction, you want to take that 5 to 10 cc's of air to put into the blue tube, so you can take that tip of the feeding tube and make sure that it's not connected or laying on the side of the wall. So I'm going to take a new syringe and I'm going to get 10 cc's of air, and I'm going to listen and put that 10 cc's of air in, and then I'm going to hook it back up again. After I've done that, I'm going to make sure the patient is comfortable and go and document. Then a few days later, the doctor says, we can actually discontinue or remove this tube. So I'm going to get all my supplies, and the first thing I do is I'm going to come into my patient's room and say, today the doctor said that we can remove your tube. So I'm just going to listen to your stomach and listen in the 4 quadrants, making sure that it's active. So I listen in all 4 quadrants, and it sounds pretty active. So then I want to make sure that I know the placement of the tube. So again, I take that 10 cc's of air, and I'm going to listen in the stomach for that swishing sound as I put that 10 cc's of air in. After that, another way that I can check is if I want to aspirate. I just take a little bit of the fluid, disconnect my syringe, and I'm going to put it on my pH strip. It says it's a 2. So as long as it's between 0 and 4, it is fine. So now I want to irrigate my tube. So what I'm going to do is I have my water, and I'm going to take 20 cc's of water, and then I'm going to take 20 cc's of air. As I'm inserting it into the tube, I want to make sure that it's at the upright position, and I'm going to push in the 20 cc's of water. That's removing the bile from the tubing. Then I'm going to want to push the 20 cc's of air, and that is removing the water from the tubing. So after that, I'm going to remove this and throw it here. And then I'm going to ask my patient to take a deep breath and hold it. And as he's holding it, I'm going to remove the tape, and I'm going to use a hand over hand motion and remove the tubing as quickly as I can, but gently. So now that I remove that, I'm going to throw everything in the pile here, and I'm going to throw this in a biohazardous bin. And I'm going to make sure that the patient has a really good oral care after having that nasal tube in, and just making sure that he's comfortable, and if you can get him anything. After that, you will go and document, and that should be the end of the irrigation and removal of an NG tube.